Today we are going to learn anti-malaria drug to be used during pregnancy. So let's start with the first trimester. Treatment of the uncomplicated malaria. Under uncomplicated malaria, which is caused by the Plasmodium vivax, chloroquine is used for the 3 days. And if malaria is caused by the Plasmodium falciparum or mixed means Plasmodium vivax and Plasmodium falciparum, both are involved in quinine is used. Now we will study for the treatment of the complicated malaria or severe malaria. Under uncomplicated malaria, parenteral quinine is used minimum for 24 hours. And after 24 hours, oral quinine plus clindamycin is used for the 7 days. Now we are going to study drugs to be used in second and third trimester. Treatment of uncomplicated malaria. Malaria caused by Plasmodium vivax, then we will use chloroquine for the 3 days. Drug to be used in uncomplicated malaria caused by the Plasmodium falciparum or mixed, that is vivax and falciparum, both are involved. Then at the place of quinine, here we will use combination of drug artesunate for the 3 days plus sulfadoxine or in for the 1 days. Now we are going to study treatment of complicated or severe malaria. In complicated malaria, we use parenteral artemisinin derivatives for the 24 hours, and after that we mainly use oral ACT for the 3 days. Artemisinin derivatives includes artesunates, artemether and arteether. Here you should note that arteether is not recommended